Good morning, everybody, and welcome to Manhattan DD Council. Kathy Kelly, for those who may not know, from AHRC New York City, and I am honored and privileged to chair this Manhattan DD Council. We will start with announcements. If you have any announcements, if you could just raise your hand and use the hand raise feature, we'll go around and do that. And then after we do that, if you don't have access to the hand raise feature, then we'll ask you to unmute. So, Jay?
Good morning. Jay Kleinman from LifeSpire. We have behavior management, parent training, either in person or remote. So I'll put the information in the chat, but if you're interested, I'll put my phone number, my email address, all of that. Additionally, anyone who might be interested with the Queens Family Support Fair is once again live and in person. That'll be on Friday at the Sheridan, LaGuardia East Sheridan, something like that. Anyway, I can put that website in the chat as well. I'll put the website for the Queens Council. It's a shorter website. And then the link to register is on there. So again, that's this Friday. The Commissioner of OPW will be there, along with many others. We have about 400 people signed up, as well as right now, I think about 60 tables in our resource fair. Okay, thanks.
Thanks, Jay. Wendy?
Good morning, everyone. Wendy DeLeon from Adapt Community Network. Just wanted to let everyone know we are currently receiving applications for all our services, which include, but are not limited to, family reimbursement, housing advocacy, home modification program, PalmHab, clinic, respite, and so on. I'll put all that information in the chat. Also, we recently hosted our annual Family Connect Summit, which I believe many of you had participated in or at least watched. Recordings will be available hopefully by next week. So we will be sharing those links and sending people emails about the wonderful workshops that were presented and all the wonderful topics that were covered. Also wanted to let you know that Housing Advocacy will be hosting a workshop on Freeze Your Rent program in December. I just wanted to start mentioning it now, and you'll probably hear me mentioning it again in the future, but that information will be shared as we get specific dates and links for you guys as well. So just make a mental note that that webinar will be coming soon. Thank you.
Thanks, Wendy. Alana?
Hi, good morning, everybody. Ohel Bezezra. We have money in family reimbursement as well for Manhattan, definitely, because I know a lot of the regulations have changed and it's a little bit more difficult to get the money. So we really ask you to put in your application so we could really help you work through the whole system to be able to get a good application. We also have money available in Queens and in Brooklyn.
Thanks, Alana. Kate?
Good morning. Nice to see everyone. AHRC has education advocacy services for students ages 3 through 21 with OPW eligibility in the Bronx, Manhattan, Brooklyn, and Queens. I'm going to put our referral form information in the chat. Please share it with families you know who need the service, and also care managers by all means. You can also submit a referral for families. And also we're going to start a Turning 5 parents group to support families with OPWDD eligibility through the Turning 5 process this winter and spring. So we're going to start meeting in January, February, and it should be a really nice opportunity for families so they don't have to go through it alone. We know how stressful it is.
Right, only the 2 assigned people. Okay.
That's it.
Thanks, Kate. Jackie?
Good morning. Much like all the other people who have family support services, we are accepting emailed applications and have funds available. Although it is a challenge, we are trying to assist families in having the right documentation in place so that we can provide the support that's needed. We can do it for Manhattan. Our contract is also for all 5 boroughs for reimbursement for goods and services. So please, I put my information in the chat. If anybody has questions, please feel free to reach out so that we can help as many families as we can. Thank you.
And Jackie, I know you'll put the information in the chat, but can you also mention what organization you're from?
Oh, I apologize. I thought I did. I said New York State Institute on Disability.
Ah,
I'm sorry.
thank you. Thanks. Any other announcements?
¿Cómo está?
¿Dónde está el indio? ¿Está ahí?
¿Quién?
El indio.
Él estaba ahí. Pero
¿A qué me llamó aquí ahorita? No sé quién fue. me llamó.
Luis, did you have an announcement?
Good morning. Sorry, apologies. I don't have camera on my computer, but my name is Tong Wen. I'm from YAI. I just want to say that our community and family services are currently accepting applicants for the crisis intervention and behavioral management programs. And I will put the flyers in the chat later. Thank you.
Thank you. Last call for announcements. Okay, thank you, everybody. We will then move on to city news and update from Gavin Myers.
Hi, good morning. Let's see, I just want to provide a few updates on both COVID and also on monkeypox or MPV. I'll start with COVID, and with respect to COVID right now, I wanted to provide a little bit about what's happening with the cases right now, and then go into some treatment options. There is a new, first of all, COVID booster that I did want to mention that has been authorized for anyone 12 and older who received their first, most recent dose at least 2 months ago. And this booster is really specifically designed to protect you against the Omicron variants that account for more than half of all the infections in New York City. So the new vaccine, about half of it is the original strain, and then half of it is this new BA4 and 5 that will train your immune system against those new variants that we expect this winter. And you can get the updated booster at the same time as other vaccines, so you can schedule the booster and the flu shot for the same day if you want. In terms of the cases, right now we're at 9.2% positive, which is stable, and daily cases are at about 1,964 on the average, which is also stable. Hospitalizations are decreasing, and deaths are currently also decreasing. Anyone who's 12 and older is eligible, as I had mentioned. And if you, some people ask, well, can I get the vaccine if I had COVID recently? And the answer to that is yes, but typically you can wait until 90 days after you first felt symptoms, or if you had no symptoms, 90 days after your testing to get the booster. And basically the minimum you should wait is at least probably 2 months, if it's been at least 2 months since your most recent COVID vaccine dose. In addition, if you're higher risk for severe COVID or of getting COVID-19 again, you can get a booster as soon as you're eligible, and talk to your provider about when you should get your next vaccine. With respect to the vaccination schedule for younger individuals, children younger than 5 years should get the same vaccine for their first and second and third doses of their primary series, and they will be considered fully vaccinated 2 weeks from either their third Pfizer dose or second Moderna dose. And for Moderna ages, 6 months to 5 years, 2 doses, and the second dose is delivered at least 28 days after the first. And with Pfizer, it's 6 months to 4 years, the age group, with 3 doses, and the second dose is taken at least 21 days after the first dose, and then the third dose is 56 days after the second. With respect to COVID-19 treatments, if you do test positive for COVID, there's several treatments still available. We have the oral antiviral pills, which are a possibility, and I'll include a PDF in the chat about treatments and where to find those, as well as monoclonal antibodies at this point are still an option as well, which is a one-time IV or injection to give you antibody protection while your body produces antibodies to fight COVID. I'll also include a little bit more information in the chat about monkeypox vaccination, as well as who's eligible. So as you may know, monkeypox is a virus that is continuing to spread in New York City. The transmission of monkeypox can be spread through direct contact with a rash or sores of someone who has the virus, contact with clothing, bedding, and other items used by a person with MPV, or prolonged face-to-face contact. And so this particular virus is one that there is a vaccine we are using to prevent the spread of. It is originally used for smallpox, but has been repurposed for monkeypox. And the eligibility has expanded for this. Anyone of any sexual orientation or gender identity who is at risk for monkeypox vaccine can get vaccinated. And you can currently get first and second dose appointments at city-run sites as walk-ins. So you do not have to have an appointment, which is a change from before when you needed to have an appointment. And the second dose is at least 28 days after the first dose, so you can wait longer than that, but a minimum 28 days. And in terms of finding out who is eligible, I'll include some information about that in the chat as well. But as I said, we did expand eligibility for the vaccine at this point. And in terms of this particular, vaccine, it's, again, it's one to consider if you happen to be at risk for monkeypox virus. And I think those are my main updates. And so, yeah, at this point, take any questions or include some of those links in the chat. Thank you.
Thanks, Gavin. Any questions for Gavin? Then the next thing that we're going to do, and actually this flows very nicely with some of the updates on COVID and monkeypox and the other infectious diseases as we enter flu season. New York City Department of Health and Mental Hygiene is collaborating with OPWDD on an infection prevention and control project. And we have today two people, Sue-Ann Jardine and Will Greendyke, to talk to us about the project and kind of go over what this is all about and see how we can kind of assist and participate in this. So, Sue-Ann?
Good morning, Kathy. Thank you so much for having us here. Will is going to start the presentation, and then we'll follow that up with us a little bit of time for questions and comments. But we're so grateful to be here, so thank you.
Great, thank you.
Yeah, let me just echo that, and thank you so much for having us on here. My name is Will Greendyke. I'm an infectious disease physician with the New York City Health Department, and I'm giving a sort of a quick blurb on an infection control needs assessment that DOHMH is conducting for organizations that run IDD group homes in New York City. I think some of you might have been on the IAC meeting last week, and Tom was gracious enough to have us talk there as well. So this might be a little bit of a repeat, but for those who haven't heard me talk yet, I'm real excited to share about this project with you. So just to do some quick introductions, I'll talk about the background of the project, why we think this really sort of adds value for the IDD setting, and then what our approach and project goals are will be the last part of the talk. So like I said, I'm an infectious disease physician by training. I have a lot of experience in healthcare epidemiology within the Bureau of Communicable Disease at New York City's Department of Health and Mental Hygiene. I'm joined by Sue Ann Jardine, who's one of our IPC evaluators as well. And in terms of background for the project, so this sort of stems from a large initiative that CDC is putting on called Project First Line. It's really a sort of a nationwide effort to really bolster infection control capacity nationwide and make sure that all frontline healthcare personnel are appropriately trained as to what current infection control practices and procedures are. I think one of the new facets of this is that, historically infection control education has really sort of emphasized more acute care settings and really just focused on physicians as well as frontline nurses. And I think there's been a lot of conversation behind the scenes about how there are a lot of different healthcare settings along with different folks who help to deliver healthcare who really would benefit from sort of increased infection control sort of training and practices. So a lot of this is informed by the COVID-19 pandemic, obviously, just given everything that's transpired in the last 2 years, 2.5 years. But it's certainly not limited to COVID. And so I think, one thing that we're really excited about doing is taking a more holistic approach rather than just sort of focused on COVID and PPE and vaccination. So one of the components of that is of the Project First Line is to conduct learning needs assessments of staff to inform the successful development and delivery of the trainings that the CDC has developed. And I think that this is actually really important, particularly in the IDD setting. So staff who care for the IDD population really have not historically been prioritized for this type of capacity building. And we really want to change that. I think that, if anything, COVID really laid bare just the need for sort of thinking through the wide variety of settings where healthcare is provided or where medically vulnerable populations are. And I think, we certainly collectively could have done a better job in sort of directing some attention to the IDD population. So I really view this as really an opportunity to sort of get a sense of what the lay of the land is so that we can better advocate for inclusion for the IDD population, both sort of locally and at the state level, as well as appealing to on a more national level in terms of what the CDC puts out in terms of guidance. And then ultimately our goal is to create a long-term tailored and sustainable infection prevention and control framework for IDD congregate settings. I think it's pretty clear that what goes on in IDD congregate settings is not exactly what goes on in sort of other long-term care facilities, and thinking about what those differences are and how we can, from a public health standpoint, work to support those populations. So as far as what our needs assessment is going to be comprising of, right now we're really targeting staff of group homes for individuals with IDDs in New York City, looking to approach with all 87 IDD organizations. And like I said, with the goal to really sort of improve long-term infection control capacity in these settings. So we're taking a two-phased approach. Phase one, we are hopefully going to roll out in the next week or so, which will be a web-based survey that I'll talk a little bit more about in just a second, followed by some listening sessions where we want to sit down with sort of frontline staff and really hear from them in terms of what their sort of experience and knowledge and comfort level with infection control practices are. So phase one is, again, this web-based survey. It's directed towards leadership and managerial staff of the organizations that operate IDD group homes. It's a 45-question survey, and again, really just trying to collect some basic information on organization, staff background, what the current practices and procedures are, and what the current infection control training practices and needs are. The results of that survey will help inform the second phase, where we want to hear from frontline staff in terms of their experience. So that second phase is, like I said, directed more towards frontline staff. So thinking, DSPs and those sorts of individuals. And we'll be conducting a handful of sessions with 8 to 10 staff per session, hopefully in the first quarter of 2023. So that part is still dependent on IRB approval and a little bit of the results of what we find out in the survey from phase 1, but we're aiming to get that kicked off next year at some point. Okay. And so in terms of how we're looking to partner with our OPWDD colleagues, really looking for just sort of maximum reach in terms of participation from all 87 IDD organizations. And I think the other thing that I want to emphasize is just the novel approach that I think this represents. Like I said, the IDD population obviously is very well known to you guys, but has historically not been a target from a healthcare epidemiology standpoint. And I think that, there's certainly lots of challenges that I think we want to highlight, and then hope to advocate up the chain to potentially change. So things like staffing challenges, staffing turnover, those kinds of things. So I think that's my last slide. Yes. So just wanted to, get the word out about the survey. Really appreciate you guys letting us come and share with you guys. I think we're really excited about the project and what this could certainly represent in terms of advocacy efforts moving forward. So I'll pause there and see if anybody has any questions, and thank you again.
Thanks, Will. Just to give people a chance for questions, but also if you could email me the PowerPoint, and we can then have that posted on our Manhattan DD Council website.
Yep, can certainly do that.
Great, thanks. Any questions?
Kathy?
Hi, Chris.
Hi, I just wanted to know, did you include the 853 residential schools in the agencies that you're looking at? Because there's a number of residential school programs in New York City.
Good morning, how you doing?
I would have to go back and double check that. I know that our overall scope is really looking at the group home settings, and I'm not sure if the residential schools would be sort of included within that category or not.
Okay, because they are under sort of the OPW umbrella in terms of partial fund, part of the funding.
Mm-hmm.
And many of them were definitely impacted by COVID.
Yeah.
In terms of staffing and trying to maintain, because they're basically pretty much 24/7 residential facilities for kids, school-age
Okay.
children.
Got it. No, thanks for that.
Sure.
Pointing that out.
Ellie?
Yeah, I think I was a little lost in some of the acronyms, but I can, so maybe you fill in the blanks in the PowerPoint. But that's just me. I don't know whether that's a whole thing, but could you explain? I'm a retired person. I don't know much about the lingo that's commonly used, but what is capacity building, please?
Yeah, no, that's, I think, a fair question. And I use the acronyms IPC a lot. So that stands for Infection Prevention and Control. And
right,
that
but somewhere it needs to be, put out there first.
Sure.
Thank you.
And yeah, I can certainly highlight that as I'm making the rounds to other DD Council meetings and for the different boroughs. So I'll take that into consideration. In terms of capacity building, capacity building refers to just sort of general preparedness for whatever response might be needed. So in some situations that can be something that's fairly dramatic. Obviously, COVID-19 is sort of at one far end of the spectrum, but even something that is not as impactful on a societal level, like monkeypox, but making sure that the folks who are in a particular facility have the tools that they need to respond appropriately. And so that could take the form of, just training and sort of situational awareness of what's going on. It could be making sure that they have the appropriate PPE, or if it's just sort of connections to folks who do have those things. So a good partnership with say a local public health department, just to make sure that when issues arise, they have a place where they can sort of take these concerns rather than just trying to figure it out on their own.
Yeah, this is just me. I understand the point and all of that. I just don't think the words make sense. Capacity to what? To handle the situation. The words don't tell you what it means.
Yeah, I can certainly refine this and make it a little bit more clearer. So thanks for that.
Yeah, for the layman.
Sure.
Thank you.
Any other questions or feedback? Then thank you, Will and Suzanne. Thanks again for joining us.
Thank you.
Yeah, thank you so much for having us. And yeah, we're excited, and we'll keep you posted as the survey opens.
Great. We'll move on to state news and state update. Sam?
Good morning, everybody. Sorry, let me take a sip of water. Good morning, everybody. Can you guys all hear me and see me? Okay, perfect. I hope everybody is staying warm and cozy on this little bit of a dreary day. So I'm just going to give a fairly quick update for this month for OPWDD. Just give me one moment. So I touched on this briefly. I think somebody had asked questions last month about the COVID restrictions, but I think this is just another opportunity for us to just go over it again, just in case people still had questions. So on September 7th of last month, the New York City Department of Health issued an updated determination as it relates to masking indoors or masking in indoor settings. They recommended that those exposed to COVID-19 wear a mask or respirator for a full 10-day period and get tested at least 5 days after close contact or sooner if symptoms develop. This guidance is applicable for all individuals, regardless of the vaccination status or history of prior COVID-19 infections or infection, I should say. Additionally, we are encouraging individuals to assess risk based on their circumstances and decide on whether masking and taking other public health measures would be appropriate for them. Better safe than sorry in general. And this determination rescinds the masking requirement in correctional facilities and detention centers like shelters. And this is for overnight emergency shelters, day shelters, and meal service providers. And any transportation areas. On September 14th of last month, OPWDD, we announced that we had issued new guidance related to the isolation and quarantine of people in OPWDD certified facilities. As of September 1st of 2022, OPWDD will no longer require masks to be worn in its certified or operated facilities, with the exception of specialty hospitals. OPWDD also no longer requires masking during transport. However, it may still be required in certain individual circumstances, like if a person is in the program or a staff member is recovering from COVID-19, or there's a suspected or are suspected of having COVID-19. So the September 7th guidance, it also more clearly explains OPWDD's isolation and quarantine guidance. and how it's applicable to certified settings within OPWDD. The guidance can be found at the OPWDD website. I will certainly share this information in the chat, but if you just go to the opwdd.ny.gov homepage, there will be a section that relates to COVID guidance, okay? Sorry, just give me one moment. I have a little bit of tickle in my throat. So the next item I'm going to discuss is the 507 plan. So the 507 plan is a comprehensive plan for OPWDD, setting direction for our agency for the next 5 years. And it requires, the state mental hygiene law requires that the plan be updated annually. So that's where the name comes for, or the 507 plan. The state mental hygiene law that governs this is actually section 5.07 of the plan. So that's why you may frequently hear it referred to as the 507 plan. So timeline, basically just to go over it. So back in May of 2022, there was a release of the draft plan for the public input. And then in June of 2022, there were there was at least 2 virtual sessions. There were public hearings all across the state for members of the public to comment on the draft 507 plan. And then during the summer, there were regional in-person public forums. There was also virtual public hearings to collect information from members of the public as well as other stakeholders about the 507 plan. And then now the next step is November 1st, which is, I can't believe this, November 1st is next Tuesday, I believe. OPWDD is going to submit the final plan to the governor and the legislature for review and hopefully approval, okay? The next item that I wanted to discuss with you about is the regarding direct support professionals. So OPWDD has entered a 3-year into a 3-year $10 million partnership with the National Alliance for Direct Support Professionals, also known as NADSP, to expand opportunities for professional accreditation for DSPs across the state. OPWDD's partnership with this organization provides access to 3 levels of DSP credentialing, as well as the frontline supervisor certification through participation in the eBadge Academy. This project is supported by funds OPWDD is receiving through the American Rescue Plan Act. So that's one way that OPWDD is utilizing the funds received from the federal government to improve the education and the careers of DSPs. The NADSP credential is competency-based, and it's modeled on the Centers for Medicaid and Medicare Services, direct service workforce core competencies, and the NADSP Code of Ethics. So to implement the grant, NADSP released a request for proposal for eligible HCBS provider organizations to participate and claim seats on the eBadge Academy. This RFP closed on September 30th of 2022. NADSP, again, which stands for the National Alliance for Direct Support Professionals, will provide access to approximately over 2,440 seats. We call them seats, even though it's virtual, but essentially over 2,440 seats for DSPs and frontline supervisor over the 3-year length of the contract. The project will provide bonuses for participants and reimburse employers for training hours for their participating DSPs. OPWDD is exploring the accreditation of OPWDD DSA trainings by NADSP. So this will be a first step in seeking to include OPWDD staff in the credentialing initiative. If you are interested or anybody you know is interested in this particular project, you can also look into it a little bit more. And at the end, at their website, which is nadsp.org. I'll also be putting this website in the chat. So for those who are interested, just keep an eye out on the chat, okay? So the next item, I feel like this has been mentioned before, but I think it's worth noting. So OPWDD has established a separate executive office for diversity, equity, and inclusion. It's called DEI. And we've hired a chief diversity officer to drive organizational change and build internal as well as external capacity for diversity, equity, and inclusion. The Executive Office of DEI will build upon existing initiatives, will partner with community-based organizations, and also engage with stakeholders in advancing diversity, equity, and inclusion within the agency as well as in the field. And then
Who's that person?
If you give me a moment, I can look that up for you. Can you give me a moment, Ellie, if you don't mind?
Thank you.
All right, maybe 2 moments if you don't mind, okay? All right.
That's okay. We can put it in the chat later.
I'll put it in the chat, but I figured I can tell you, but I
Yeah.
guess my lightning fast fingers are not as lightning as I thought they were. But
Well,
I will make sure to put it in the chat, okay?
Thank you. Get caught up in your cough.
Oh my gosh, possibly. You know what? I will, oh, actually, I have her name. Her name is Hira Mir, H-I-R-A-H, last name M-I-R, again, H-I-R-A-H, M-I-R. M-I-R is her last name, Mir, and she's our Chief Diversity Officer at OPWDD, okay? And she is the person that you were thinking of, but I'll also put her information on the chat. So the OPWDD's housing strategy is the next item I wanted to discuss. So OPWDD, we've developed a housing strategy that supports goals for the developmentally disabled. This is an important goal for them to gain independence through housing, not just necessarily certified housing, but also what used to be called ISS, but now is called a housing subsidy, where OPWDD will pay a portion of the rent. The individual contributes, I believe, up to 30% of their income towards their rent. And so that encourages more independence, because we do have more independent-minded and individuals who are also able to live more independently without as many supports. So the housing strategy aims to ensure that the system can provide people the right service, the right level of support. And, you know, it could go from a supervised setting, it could go from an ICF to a supervised setting to a supportive setting, all the way to a housing subsidy, which is probably, I would say, the most independent form of living. So that's the range that is offered. There was recently a funding for an increase in the housing subsidy payment standards. I believe that helped bring us up to market levels. I know New York City has had, you know, higher rents, and sometimes our thresholds are not as reflective of that. So this is specific to the housing subsidies that are for people who are living in an independent setting. So funding for an increase in the housing subsidy payment standards to market levels was included in the executive budget for fiscal year 2022 to 2023. The 2022 ISH funding opportunity, which is also it's called ISH's Integrated Supportive Housing, but it's basically the housing subsidy. It will award $15 million in projects to expand access to affordable, accessible, non-certified housing options for people with developmental disabilities. So I have been sending emails. I hope some of you have received these emails. I imagine all of you have received them, but Block Institute had programs in ISH development in Brooklyn. New York Foundling has had an ISH project also in Brooklyn. And we are working on working on a project that will soon be available in, I believe, January or February of 2023. And that is going to be located in the Chinatown area of Manhattan. So these are opportunities that are coming up or have already come up. And, you know, it's through this additional funding that we've been able to bring this to fruition. The next item is the HCBS settings rule compliance. So the March 17, 2023 transition period deadline for full compliance with the home and community-based services setting regulation, you know, it's coming up. And, you know, unfortunately, CMS will not be extending the deadline. So they're remaining firm on the March 17, 2023 deadline. DQI continues to monitor the HCBS services for compliance with HCBS setting standards. The family care monitoring process has also been updated to include the HCBS setting standard. OPWDD is working with the Department of Health to update the OPWDD section of the HCBS setting statewide transition plan. CMS, new additions. It's, I believe, a consulting group that works with Centers for Medicaid and Medicare Services and a representative of the Administration for Community Living. They will be visiting New York State next week to observe a few settings that are subject to the heightened scrutiny. The visit will include at least 2 settings certified by OPWDD, as well as settings operated by other state offices. So hopefully maybe they'll give us feedback so that we can provide updates on the outcome of those visits by maybe next month's DD Council or December's DD Council. We'll keep you posted, okay? And there's been a few administrative memorandums and regulations that have come out since we last met. On September 14th, OPWDD adopted new regulations related to the Certified Residential Opportunities, the CRO. These regulations will take effect March 14, 2023. This is available also on the OPWDD website. On August 19, 2022, I'm going back a little further just in case, OPWDD issued the ADM related to service documentation for community transition services. So this ADM describes the program standards, the payment standards, and service delivery and service documentation requirements to support the provider's claim for reimbursement. So this ADM was originally issued back in 2015, and it's now been updated to reflect the new billing standards and terminology. And if you want to compare the 2015 version versus the current version, any new updates that have been added to the current version issued on August 19th, those revisions will be highlighted, or I should say bolded and underlined, just so you can compare to see for yourself what the updates are. And then on September 28, 2022, OPWDD issued a revision to the CSIDD ADM. So that is also something to keep an eye out on. CSIDD used to be called New York START, but now it goes by CSIDD. That's a new term for it. So all these ADMs are also available for any member of the public to review and to read through on the OPWDD website. So that concludes my presentation for OPWDD updates.
Thank you, Sam. Jackie, you have a question?
Hi, good morning. That was a lot of information. Thank you very much. My questions, I'm going to go back to the beginning. The DSP Academy, can you, first of all, is that going to be open to DSPs that work for families at Self-Direct?
It should be, but like I said, I can't I mean, this is very, very specific, your question. I think you're asking very good questions. I believe it should be, but just to be on the safe side, like I said, I'm going to put the link in the chat box so that you yourself and anybody that you know that may be interested can actually look through it just to double check, okay?
Okay, and what is, it's going to be like a virtual curriculum where people sign in at their own
Yes.
pace and off hours, and then they earn credentials?
I don't know if it's at your own pace, at your own hours. There's most likely going to be set classes, and those are going to be virtual classes. That's my impression again. So, I'm sure they'll try to make it so that people are able to attend the classes in some way, shape, or form. I know DSPs work, many, many hours over many shifts, but that's my impression. But it is a fully virtual one, unless they say otherwise. It is supposed to be a fully virtual class because they talk about seats, but it's really a virtual class. So basically slots is what they're talking about for attendees. And this is over a 3-year period. So not that the program will take 3 years, but they'll be offering this the courses to attendees who want to participate over a 3-year period, basically.
Okay, thank you. And 2 questions about housing. Do you have a percentage on the housing increase?
I do not have a percentage on the housing increase. All I know is that there was a recommendation for a housing increase that was included as part of the budget for 2022 and 2023.
And last question, you mentioned something ISH. It went by quick.
ISH.
Can you just say what that is?
Oh my gosh, quiz time, my goodness. No, sorry, give me one moment.
Integrated supported housing.
Yes, thank you.
So you're
Ellie,
saying
you're like so good. Thank you. Yes, that's what it stands for. So there are a number of ISH projects that are that have been completed, or and there's one that's about to come out as well. So Jackie, go ahead. I
How do you define integrated?
So it's going to be, so essentially it's integrated in the sense that you're not living in a group home or anything like that. You're going to be living in a building, just like a regular residential building. It's integrated into the community. So it's not like it's a home where there are other people who are at your functioning level or whatever the case may be. You're going to have a home in an apartment, and it's going to be in a building where other residents are, who are non-developmentally disabled individuals are living, and so you're going to be integrated. We try to make sure that it is in the providers who are approved for this initiative are going to be developing in an area that is close to grocery stores, that's close to public access space, that's close to public transportation, because we want people to really be integrated into the community. There's no purpose in having our individuals move into an area there's not really much going on, and so we want them to be integrated into the local community.
So are we speaking strictly about people who have very low support needs, or are there going to be supports available, excuse me, like wraparound supports available to people who are living in this integrated setting?
So in this sort of setting, it's basically a housing subsidy that they will be receiving. Those individuals usually tend to be able to have a job. They tend to be able to manage their own funds. They're usually able to, take any medications. If they have any medications, they're able to cook for themselves, nothing complicated, but they can make simple meals. They can evacuate in case of a fire. But certainly,
okay,
there are
that rules out a lot of people, but okay.
Well, I wouldn't say okay, like I guess how you look at it is it
From
could
my
rule out like,
perspective, yes.
oh, yes. But, you know, there are, it's not wraparound support still. What the individual can receive is community habilitation. They can also receive, I guess, if they wanted to, they can receive these sorts of suite of services, but I wouldn't necessarily say it's wraparound services because they really do have to have a sense of, not a sense, but they really do have to have a level of independence to be able to support themselves independently in these sorts of settings. Now, maybe for the individuals that you're thinking of, maybe a supportive setting might be a better bet for them, or if they need even more support, the supervised setting may be better for them. If they need that level of support, then I would say CROW, the Certified Residential Opportunity Department may be the best bet for them so that they can access residential placement by working with their care manager, who will work with the CROW unit, who can find an appropriate setting for them that best meets the needs that they have.
Thank you.
No problem. Maybe that was a long-winded answer.
That's okay.
But I wanted to cover all my bases.
Appreciate
just in case, okay?
Yes, thank you.
Not a problem.
Ellie, you had a question?
Well, I have a lot of comments, but I'll try to make it a question. The housing strategy that OPWDD put out is there, it's out there, but until the 507 comes out, we won't know how it's being implemented. Is that about right? I mean, how do they determine?
One of the things that's been released is the new guidance document as it relates to the Certified Residential Opportunities list. And like I said, that's available on the OPWDD website. But if you're talking about future changes, like related to funding, yes, we would have to wait until that plan is reviewed and approved. And the recommendations in that plan, once they're reviewed and approved, then it would go into the implementation stage. So in that regard, yes, you are right.
Yeah, and the HCBS rules compliance has, where can we read the settings rule? And then we some of us can get really nervous about it.
HCBS settings rule. That you can find on the, I believe it's on the Medicaid website.
Okay.
Medicaid.gov website. I mean, a whole host of social organizations have it as well. The ACLU has it, but I think it's better to go just directly to the to the entity that generated the rules. So I think if you go to the Medicaid website, the CMS website, it will have it, and you'll get the unabridged version of it.
Okay, this is just a very nervous person worrying about it. What happens when you don't meet the standard, the settings rule, you know, for too many people or whatever? Do you get a waiver of existing stuff, or I mean, this will be very punitive.
This is a little new to me as well, so I hope that they give us an opportunity to correct any deficiencies that we may have. I hope that they just don't immediately say no and then just go to the penalty section. Yeah, let's hope. But I do hope in the past, you know, especially as it relates to any kind of audit, they usually give you some time period to correct the issue or to create a plan of corrective action. So I'm hoping that that is something, a courtesy that they'll extend us as well. But like I said, you know, you never know until, you know, this is the first for me as well. So I think I have the same concerns as you, but we'll see what happens. And, you know, the visit is happening next week and we'll see, right?
Yeah. Thank you.
Not a problem. And thank you for keeping me on my toes, guys.
Margaret?
I believe, but I'm not positive about this, that when there's an HCBS settings rule, such as you have to have a lock on the door, you have to have access to food at every hour conceivable, that I think it's possible to get waivers for individuals. Kathy, do you know if that's true? Jim, do you know? Chris?
I don't know, but knowing the range of people that we support and for their health and safety, I'm sure there have to be some type of accommodations for that. Because for some people's health and safety, for instance, if someone has pica, you absolutely don't want, and if you did, you would be absolutely jeopardizing their health and safety.
Right.
So, I'm sure there's got to be some allowances and accommodations.
And I
Yeah,
mean,
that's the logical answer.
yeah, and OPWD does, DQI, which is part of OPWD, Division of Quality Improvement, I believe. They continue to visit homes and do regular check-ins just to make sure that the provider is in compliance. So, we already do have a system in place to ensure adherence to those standards, but sometimes somebody else will come in and they may take even more of a keener eye. And so, we look forward to their feedback, and yeah, we'll see what happens.
Jim, were you going to say something?
Oh, no, I just, that Kathy gives the logical answer, but
Mhm.
we've always seen, throughout 50 years here, that the results don't always turn out to be logical. And so I believe, though, attacking it on a person-by-person basis is probably the best way to do this.
Any other questions? I have one final question, Sam, and I know as of Tuesday, OPW's part on the 507 will have been completed. Is there an estimated timeframe on when this will be publicly available?
We do not know. Well, I should say I do not know. Let me clarify, but I can certainly check. I know that on November 1st, we'll pass it along to the governor and to the legislature, but your question is, like members of the public, stakeholders would like to know what is being passed along to the governor and legislature, right?
And how long they have to act on it?
I will look into it, and Kathy, can I send you an email with the answer, and then you can share with the larger group?
That works.
All right, thank you.
Thanks, Sam.
Not a problem.
Okay, we'll move on to IAC report. Chris?
Hi, good morning, everybody. I'm sorry, I'm just actually looking at an article that just came out, which disturbs me even more. So on October 19th, I just want to share with you the city council hearing. City council hearing was an oversight hearing on early childhood in New York City. I testified on behalf of IAC regarding the preschool special ed situation. But what was actually more concerning, and I'm starting to sort of alert people to this, the hearing started at 1 o'clock. The Department of Education testified probably for about 2 hours. And then for the next, I would say almost 3 hours, early childhood providers in New York City, meaning daycare providers and childcare providers, all testified that the city Department of Education hadn't been paying them for their invoices. And we had information, there was Sheltering Arms testified that they're actually closing their early childhood program after providing early childhood services in New York City for more than 100 years. Some agencies were owed more than $6 million. There were childcare providers who testified that they haven't been paid in 8 weeks and they can't pay their rent. And the reason that it was so concerning to me is that the New York City Department of Education is now offering this form of contract enhancement to all the 4410 providers in New York City who agree to provide additional services to children, but they're going to have to bill these invoices every single month. There's 130 4410 providers in New York City that have applied for the contract enhancement in New York City. And my understanding is right now that only 20 of them potentially have contracts that have been approved by the Panel for Educational Policy. which means the majority of providers still don't have any contracts at all. And we're very concerned about any kind of lag in payment to our providers, because what the Department of Education has linked to the contract enhancement is the salary parity for our teachers and staff in our schools. Just to give you a reference point, so about 3 years ago, the New York City Council and the mayor's office put funding together to ensure that all early childhood teachers in New York City would receive a starting salary equal to starting salary for a teacher in the New York City Department of Education with a master's degree who's certified. They left our teachers out of that. And for the last few years, we've been advocating very strongly to finally get funding for our schools so that our teachers can get paid the same amount of money starting salary. And we finally got it at the end of the city council budget last year. In the final city budget, it was there after a lot of advocacy. However, the Department of Education has linked that to agencies needing to be part of the salary parity. So if an agency isn't part of salary parity, they don't receive the money. Or if an agency hasn't started the services, they will not receive the money. We know within IAC that 87%, roughly about 80% of our providers are all they're hoping to start these services in January, which means even in the best case scenario, if they bill the invoicing in January, they may not get any money to raise teacher salaries until February at the earliest. And the reason I'm telling you this is because our schools are still facing a massive staffing crisis. Many of our schools in the last 2 weeks have lost teachers to the Department of Education. They've lost staff. They are still unable to recruit effectively. And so we have a lot of teacher vacancies. Just to give you some idea, we did a survey of our agencies about 3 weeks ago to ask them, how many classrooms do you currently have that are approved by the state education department that should be open, but aren't open because you don't have staff to basically safely operate them. And out of our preschool providers, we found out there are 94 classrooms currently closed. That's a lot of classrooms that are currently closed. And for our school age programs, we found out there's 57 classrooms that are currently closed. To put that in context, at the hearing last Wednesday, the New York City Department of Education basically told the city council chair of the education committee, Rita Joseph, that at the end of last year, there were 800 preschool students waiting for services, 800. And when they were asked how many currently are waiting, they couldn't give the chairperson an answer, and they said they would have to get back to her. We believe it's probably more than 800. And that number is really going to climb because you've got all the children in about 2 months who are all going to leave early intervention. And early intervention, from what I understand, is basically fully back in terms of enrollment and numbers. And so that means that a large number of children are going to leave early intervention. And again, you know, there were some questions asked about this in terms of what their plan is. And their plan, from my perspective, is a little, you know, suspect, I would say. I mean, they're expecting to get about 400 something seats from the contract enhancement. I'm not aware of any IAC provider that's looking to add seats. And then they're looking to add some other seats in a few other ways. And their goal is to maybe get to about 699, which was the number they quoted at the hearing. That still leaves almost 200 seats vacant, and that doesn't account for any of the children leaving early intervention. The other place it doesn't account for are all the children that have been referred into 3K and pre-K for all, who we know right now, who are being referred back for evaluation, who need special education services. So this is really becoming, I think, a major crisis that the city is going to have to deal with. And I'm a little concerned that I don't really see a concrete viable plan in terms of how to address a lot of this. And if our schools, our preschools continue to lose staff, even the classes they're operating could potentially become in jeopardy if they don't have enough staff to safely operate. So it's certainly a real issue. The other concern that was raised is that the city, for most of the money in the contract enhancement, it's based on the federal ARPA money. That ARPA money is going away in 2 years. And at the hearing, when the Department of Education was asked how they're going to fund the contract enhancement moving forward, their comment basically was, well, we've gotten money from the federal government, from the state, and from the city, and so we expect them all to help us to continue this. You know, I'm not really sold on that being a really good viable option at this point. So there's some real concerns around around the implementation of some of this. The other number that I wanted to share with you, and I shared with the City Council on Wednesday, is that if you look at the mayor's management report, the percentage of children still being served by our 853 schools is very high. Our 4410s, excuse me, our 4410s still serve 85% of all the preschool children in New York City who have an IEP. So the 4410 providers are the provider of service. New York City only provides service to about 15% of the kids, and the majority of those children are in inclusion or integrated settings. The most concerning number of all of them is the number of preschool children who are receiving special education this year. That number is more than 5,700 fewer children than before the pandemic. So New York City has 800 children currently waiting or more, and there are 5,000 fewer children receiving preschool special education services than before the pandemic. What we know from looking at some of the numbers nationally, especially early intervention otherwise, the children are coming back. The children are coming back with higher levels of need than ever before. And we are concerned that if New York City gets even half of those kids back, how would New York City be able to cover them at all? So there's some real issues here, and we will be trying to keep the councils aware of what's going on. These are children who are suffering, many of them who had no early intervention at all. And I know because I've spoken to some parents who have been trying to get their children evaluated and they can't get them evaluated. Evaluation sites are overwhelmed with children. And our evaluation sites told me at a meeting about a week and a half ago that if a parent called them, it was 2 weeks ago. So if a parent called them on, I think it's the 19th or something, the middle of this month, they were scheduling for December already. So it's a real significant backlog. So we certainly will keep you apprised of all of these things. And the last thing I'll just mention to all of you, especially for preschool children, New York City DOH MH Bureau of Child Care requires that all children 6 months to 5 years has to have the flu vaccine in order to attend programs. They are going to enforce that this year. We've been told that. So we are trying to get the word out to our preschool providers to make sure the families know to get the children vaccinated, because as of January 1st, if they operate as they had in the past, if a child is not vaccinated, the child may not be able to attend preschool at that point. So we're trying to alert as many people as we can to that. I don't know if anybody has any questions.
Jackie?
I guess it's my day for questions.
That's okay.
Chris, I have a question. My question is, you use the word enhanced contract. What is enhanced about it?
I'm sure. I didn't know if I should go into it or not. So basically, the enhancement has a few components. So one is that our schools would provide the same amount of hours of service as all early childhood, like pre-K and 3K, so 6 hours and 20 minutes. Right now, under state regulation, 4410 schools have to provide 5 hours of special education instruction. The extra hour and 20 minutes, in theory, would be funded by this contract enhancement. So it wouldn't be any more specific special education instruction,
Mhm.
but it would be an opportunity for the children to remain. There's a nap time built into it and meal time.
Okay.
And then there's a requirement that our schools would have to follow the early childhood curriculum, which all of our schools pretty much do because of state requirements under regulation. And there's a few other sort of requirements, but what it really does is it brings all the 4410 providers under the early childhood portfolio umbrella for New York City DOE. So the idea would be a child comes in, at 3 years old, parent is interested in, say, 3K for all. They determine the child might need some more services, and the system itself would be able to serve the child in a sort of a streamlined fashion rather than going to an entirely different system of 4410. It would be all part of the Department of Ed.
Totally makes sense. My next question was going to be that I heard that there's more funding you have.
You're kind of breaking up, Jackie.
Yeah.
I think I kind of lost you. Hello?
Sorry, I keep freezing. No,
Oh,
you
okay.
answered my question. Thank you.
Oh, okay. You're welcome.
Thanks, Chris. Just
Okay.
before we go on to committee reports, there's a question in the chat about a parent of a 24-year-old who is on the autism spectrum looking for information on how to get information or access to the integrated support and housing. So Sam, I think you're still with us. I know I would initially say probably I would suggest starting with your care coordinator or your care manager. But I'm not sure if integrated support and housing or housing subsidies require care management. So Sam, if you're around, can you add or respond to that? Sam, are you available? Then for the person who asked that question, again, I would suggest seeking your care manager and finding out about the ISH, or for us old timers, we used to call it ISS. But if you have a care manager, that would be your first start. If not, then I can definitely ensure that Sam's email is included in the chat, and that would be the next contact to make. Moving on to committee reports then. Manhattan Family Support Services Advisory Council. I know Mary is on the road to Albany, so Jackie.
Yes, Mary is on the road for her first person statewide meeting, which is very exciting. We have been kind of busy with the networking with families and parents, trying to provide resources and contacts. We are going to be having our first fall meeting on November 3rd, and that's going to be about housing advocacy. Wendy DeLeon and Marmee Charterwell from Synergia will be presenting. And we have not done one of our meetings on housing yet. So we're looking forward to that, and perhaps getting some new families involved with our, with our committee and with the services. That's it.
Thanks, Jackie.
That's not it. There's the family support, statewide family support is today at noon at the end of this. So hang up this one and go on to that one.
Yes.
Jackie, is it in person or is it?
It's both.
Great. Okay.
It's in person if you're a rep, and it's virtual if you're a regular person.
No. Your meeting. What are you doing with your meeting?
Oh, I'm so sorry. It's
Okay.
virtual. Yeah.
Okay.
Sorry about that.
Fine, so you'll give me the link and I'll put it on in the minutes. Okay, great. Thanks.
Yes, thank you.
Thanks, Jackie. Transition Committee, David?
Hi, everybody. So the Transition Committee met back on the 12th of October to talk about the eligibility process and provided a kind of overview of eligibility for transitioning students and families. We're going to be meeting again in December on the 14th at 10 a.m. We'll be talking about employment at that meeting. So we hope to see you there.
Thanks, David. Family and Provider Information Committee, Wendy or Louisa?
Hi, good morning. Can you hear me?
Yes, we can now, Louisa.
Hi, good morning. So Wendy and I have gotten together to come up with some of our preliminary meeting topics for this coming year. And our first one will hopefully take place in the month of November. We'll send out an invitation once we have secured our first guest, but we are looking at a couple of repeat topics and a couple of new topics from last year that were really well attended. And we're hoping that will continue to be the case. So we will send the invitations out as soon as we have confirmed our guest for November.
Great, thank you. And finally, legislative. Jim, any?
There's not too much that goes on at this time of year legislatively because the legislatures are not in session. The OPW, however, is preparing its budget. IAC has been talking about having to lobby in the spring for COLAs, and that should not be necessary. COLA should be part and parcel of operating, of continuing to operate. It is a basic piece of operating all programs. The same with having to lobby to get salary enhancements for direct care people. Everybody throughout the state knows, throughout this country knows how difficult it is. And it should not be just on the our side of the community. This should be part of New York State's commitment to keep the programs going. And without these two items, and they're extremely large, by the way, I don't see how the future has any real hope. So we'll see, of course, after Election Day first, for one thing, see where the pieces lie. But we're also looking forward to the January budget to see if these two items are in there, because both of those are extremely important.
Thanks,
That's all
Jim.
I have.
Ellie, you had a question?
Yeah, and before all that, we all have to vote this time, no, seriously, we all think New York is a done deal and, we're safe and everything, and not so this year. So there's not only in New York City, everywhere. Senator Mannion, who has been the champion in the New York State Senate for us, it has a hard election going on. So I know we don't live there, but maybe you know someone who does. Included in NYC Fair's last blast was finding who's running, because redistricting got it all, screwed up in your head. You don't even know where you live anymore. Why are they blending? I don't know, this Queens and anyway, so find that out. And then there was a second link. So if you go to nycfair.org and look for our last blast, there are two links that are very helpful in figuring out, I can't if we don't get friendly people in the legislature and in the governor's office, you know, we might as well just move to somewhere. I don't know. It's very upsetting to realize that New York can just get screwed.
We did.
And we
have-
can't be political, so.
I know, and I will not be political. However,
We have to vote.
yeah, you do need to realize and understand and take a look at the change that we've had this current year and this current budget. And, you know, what was accomplished was phenomenal and tremendous, but it's only a start. And I gotta tell you, it can disappear and change at any time. So 2 weeks from today, go out and vote. Early voting actually starts this weekend. So please make sure you vote. Make sure that your loved ones and people with that we support, if they are able to vote, that they actually go out and do that as well. It's a great opportunity and it's a way to make your voices heard. So let's make our voices heard loud and clear. Any other questions, comments, concerns? Then thank you all, and our next meeting will be on November 15th via Zoom. And I will once again try to make sure that anything that goes out does not have the Teams link built into it. So thanks again. Have a great day and make sure you go out and vote. Thanks all.
Stay well, everybody. Stay well.